Hi guys, welcome to day 2 of week 10. So this week, if you remember, I said we are focusing on phlebotomy. That was going to be related to chapters 47 and 44. In the day 1 video, I did go over and I did discuss chapter 47, which was your introduction to phlebotomy and your roles during that procedure. So today I want to focus on chapter 44, which is really dealing with the clinical laboratory. So it's really important that we start off by discussing why clinical laboratories are so important. It's helpful to not only your physicians but your patients, those clinical laboratories, because they provide a way to screen for disease, a way to confirm a condition that is suspected by your physician. They serve as a way to rule out a condition or diagnosis. They're used to establish a baseline level for medications that are to be administered. They offer a way to monitor the effectiveness of a treatment or a medication, and as a way to assess the progress of a disease. Now, laboratories, clinical laboratories, and results generally fall into two categories. They can be qualitative tests or quantitative tests. Qualitative tests will be tests that provide either a positive or a negative answer, or a positive or negative result. They're going to be looking for the presence or absence of a specific substance. For example, a qualitative test could be a pregnancy test, positive or negative. Quantitative tests, on the other hand, are tests that give a numerical value. For example, like when you do a glucose test, you're looking for a numerical value, 82 milligrams per deciliter. That's what a result for a glucose test would be. Numerical value, quantitative test. It's also important that while we're talking about this chapter, we discuss some of the important lab regulations and amendments that were put into place. The first and the most important amendment that you need to understand is CLIA, or Clinical Laboratory Improvement Act. This was created in 1988 as a way to protect patients by creating safety policies and procedures. This amendment addresses issues of quality control, quality assurance, record keeping, and qualifications of the personnel performing the tests. It has established standards to ensure test accuracy, reliability, and timeliness of results that the patient receives. The regulations for this CLIA Act are 4 sets of rules. First and foremost, laboratory standards, user and application fees, procedures of enforcement, and the approval of accreditation programs. So all labs, regardless of their size, need to be registered through CLIA. If they are not able to run any patient samples. Another amendment that is really important for you to know about is OSHA, and we know that as the Occupational Safety and Health Agencies. We have spent a great deal of time in this course and in this class talking about OSHA, so I'm not going to go over that. But again, it is always important for you as a student and as a future medical assistant to kind of be knowledgeable and review OSHA standards. So now that we understand the fundamentals of a clinical lab and some of the amendments that were put in place, CLIA talked about quality assurance and quality control. So I think it's really important that we discuss what those are, because those are part of your everyday life as a medical assistant. You'll be responsible for those 2 programs. So quality assurance is a responsibility of the medical assistant or laboratory personnel for carrying out procedures that involve planned and systematic activities to ensure that requirements are met and results are accurate. Obviously, this is very important because we want to give patients the most accurate test results so we can have the best health care for them. Quality assurance will and shouldn't always include quality control, orientation of your personnel, documentation of the controls in a control log, routine maintenance checks on all equipment and instruments used, required calibrations of instruments or machines used, regular temperature checks on the not only the controls that we use, but the refrigerators and freezers that we use, checking the expiration dates on the test kits and reagents that are used on patient testing, and doing proficiency testing. Quality assurance programs also developed what we call reference values or normal values, and these will differ depending on the different labs that you work in. Now, quality control is part of a quality assurance program, and it's really focused on the physical proof that results are accurate. Now, this is done routinely by two different tests, either calibration checks or control solutions. Calibration checks are specifically prepared test strips or cartridges that are designed to produce a predetermined result. These will generally be done on certain machines, not all test kits, but maybe specific machines, such as your LDX cholesterol machines. I know that one definitely has a calibration check, and your hemoglobinometer. Now, a control solution are a chemical that is produced with an expected result. We generally have a range, and it's going to be very similar to the testing specimen. So, for example, if you're doing a urinalysis, the controls for that will generally be very similar to that of urine, or if you've got a blood sample, it'll be very similar to a blood sample. Alright guys, that is the basic overview for Chapter 44 that I want to do for you. Day 2 of this week, we're going to be, practicing some more venipuncture, but we're also going to touch on some vital signs. We're going to review and practice some injections, so please come prepared for those. Lots of sticks are going to happen this week and this day, just because we're getting you ready for your practical final exam. Alright guys, I look forward to seeing you all on Day 2. Have a wonderful week, and come prepared. Remember, eat before class, drink plenty of fluids. Bye guys.